Hi everybody, welcome to Healthline. My name is Gregory Zarian. Happy New Year. Did you have an amazing holiday? Did you have a great New Year? And let me ask you a question. Did you wake up on the first day of this new year and go, okay, this is what I'm doing and this is my New Year's resolution? Well, let me just share this with you. When you say the word resolution, you set yourself up to maybe fail. What about this is my New Year's intention? It allows you to make mistakes, be human, do things at a slower pace. Now with the holidays, we all eat a little bit more. We don't work out as much. We say yes sometimes when we should have said no, and we've all put on a couple layers. What is your intention? We here at Healthline invite you to get your healthy intention on. Instead of having that soda, maybe have a glass of water. Instead of that cookie, reach for a carrot or an apple. Take baby steps to get your health back on. The conversation today is all about our heart. Our heartbeat, what it does, it is the hardest working muscle in our body. Joining us from Adventist Health Glendale are Dr. Harry Balian, interventional cardiologist, and Dr. Amir Sadrzadeh Rafie, interventional cardiologist as well. Gentlemen, how are you?
Great.
Thank you.
For having
me. I've known you, what, 8 years?
Yeah.
Doctor, and we've known each other for
I was here last year.
2 years. So
yeah.
happy anniversary to all of us. Before we dive into taking care of our hearts and what we need to know as per last year and how it's changed and just healthier ways and more information on cardiovascular disease and what we need to do. Doctor, tell us about your medical history.
Well, I did my training at UCLA, and I was in Chicago for my medical school. Did my residency and fellowship at UC Irvine, and did a year of interventional fellowship at George Washington University. So currently I specialize in interventional cardiology, but also peripheral vascular disease, basically taking care of disease in the arteries of the heart, the legs, the carotid arteries. So basically, we do primary prevention as well as secondary prevention by taking care of vascular disease in all spectrums. So.
And Dr. Rafie?
I graduated from Tehran University Medical School, and after that, for a few years, I was at Stanford as a research fellow, and before my residency at Yale New Haven Hospital, Yale Yale School of Medicine. Then I came here to LA. I did my cardiology fellowship at Cedars-Sinai and interventional cardiology at UCLA. And then for the past 2.5 years, I had the opportunity to join Glendale Heart Institute, Adventist Health Glendale, and I'm so grateful to the opportunity and working with my awesome colleagues.
Right, I love that. That's a great word, awesome. I'm here with two superheroes. Okay, before we dive into everything of the heart, I'm going to ask you a question, and let me see if you know this. How many times does the human heart beat a day? When we come back, the answer and everything you need to know about your heart. Don't go away. Welcome back to Healthline. I am Gregory Zarian, and today it's all about affairs of the heart. So I left you with a question. How many times does the adult heartbeat beat a day? What do you think? Answer is, doctors?
100,000.
Good job. Doctor?
Yeah, you could actually, if you count it, that would be more than 2 billion times in 7 years. And nowadays, the average age of people, the life expectancy is much more than that. And if you think about it, Gregory, it does it non-stop. So if you
24/7.
Yeah, and
that's why it's the hardest working
that's
muscle.
more than 2,000 gallons of blood circulating through your body through that strong heart muscle, and that would be more than 700,000 gallons of blood.
Well, you're good with math.
In a year.
Good with 100,000
so it's
a day. No,
it's an amazing organ. So that's
is.
why we have to emphasize on the health of it.
It's amazing that the small muscle,
the size of our
your
fist,
we use it and abuse it. People don't take care of themselves, smoke and drink and eat unhealthy and expect those small coronary arteries that are the width of the tip of our pencils to not to stay healthy and open. So
I'm gonna address the smoking and the drinking a little bit, but let me ask you a question. Since we've known each other for years, and a year, but I bet I've known you a little bit longer. How are we in regards to heart health in this community? Are we doing better? Are we doing better than we were 8 years ago? Is there more of a conversation about us being healthier?
in general, Glendale has been unfortunately dismal as far as heart health, and I see a lot of the youngsters smoking and not taking care of themselves. When I first came to Glendale, it was about 11 or 12 years ago, and I used to see a lot more heart disease, and now I feel like there's a lot more education and people are more well-versed as far as taking care of themselves. But I also see a lot of the youngsters still addicted to tobacco and not taking care of themselves. So we see a very diverse group of patients, but in general we see a lot more coronary disease per capita in this area than a lot of other parts of California and the nation.
Why do you think that is, Dr. Rafie? Why do you think that is?
If you think about it, healthy lifestyle and diet are the strongest weapon we have to fight cardiovascular disease. And it may not be as hard as we may think. And so we just, it's the overall, it's the overall pattern of choices that we make that ends up to define, our overall health and heart health.
But do you think, because you were saying the younger crowd is smoking more and maybe doing more things that are not great for their body, why do you think that is? Why do you think we're doing more that's unhealthy than people my age, our age, doing more that it is healthy?
Unfortunately, some of these youngsters emulate their parents, and I see people in their 40s and 50s smoking. They set a bad example to their kids, and then also the unhealthy lifestyle. And I also see a lot of some of these youngsters, unfortunately, being addicted on the drugs, the crystal meth and the cocaine. So they come in with enlarged hearts, cardiomyopathy, as we call it. I have had, I have seen patients as young as 22 with an actual heart attack, blocked artery, which I had to stent, and this was in Glendale. And of course, seeing patients in their 20s and 30s with enlarged hearts, weak hearts.
Now, is this due to drug addiction and people being unhealthy?
Well, I mean, it could be. It could be to do a lot of the youngsters with weak hearts. Either they've had a virus that's attacked their heart muscle,
okay,
or they've been addicted to a lot of the stimulants like heroin and crystal meth and cocaine that causes coronary arteries to go into spasm, and then their hearts enlarge and get weak, and then subsequently they end up having a full cardiac arrest. Because
isn't it true when we were in our 20s or when somebody's in their 20s, we don't think it's going to happen to us? But somebody in their 20s can have a heart attack from this as well, from anything.
Yeah, from anything. Like we have disease like Mariana-induced vasculitis. I had a patient that they had to chop his leg because of that, and they had to cut it, and it was so sad because he was in his early 30s, and it was totally different lifestyle changes for him.
So then, doctors, what do you say to somebody in their early 20s that is hooked on drugs or drinking or smoking or whatever? What do you say to them right now in regards to make them stop?
You are not invincible. We are all mortals, and basically you're starting to dig your own grave early on, and you continue this path. Within a couple of years, I assure you, you're going to be a local resident of the hospital and eventually a local resident of the mortuary. I mean, it's a sad truth, but that's what it is.
I love that we're starting this way about saying, here's the truth. We don't last forever. And I smoked, and I told you this for years, I smoked 2 packs a day for over 20 years. And I saw my mom, who died from esophageal cancer due to smoking. She died in front of me. So when we think, oh, it can't happen to us, it can happen to us.
I lost my uncle at age 44. He used to smoke 3 packs a day, and I used to beg him not to smoke, and he had a massive heart attack and died in front of me. So I know firsthand the disasters that tobacco and unhealthy life choices create. So
here's to your uncle, here's to my mom, and here's to everyone. You know that has passed away from smoking, drinking, and drug addiction. Here's the truth. The one thing we at Healthline always want to give you are healthy alternatives. You either smoke or you don't smoke. You either drink or you don't drink, and it all starts at home. Mom and Dad, put down the cigarettes. If you're going to have a glass of wine, have a glass of wine in moderation. And in regards to drugs, bottom line is drugs are an addiction and people die. When we come back, we're going to share with you all you need to know about keeping your heart healthy. And here's one more question. How big is your heart? When we come back, we'll let you know. Don't go away. Welcome back to Healthline. I am Gregory Zarin, and it's all about affairs of the heart. So I left you with a question. How big is your heart? And I said it in the very beginning. It's as big as your fist. The muscle in your chest right here, this big, works 24/7. And here to share with you all you need to know about keeping your heart healthy from Adventist Glendale is Dr. Harry Balian and Dr. Amir Rafie. Doctors, I know we started just out of the gate very direct and being very clear, because we all take it for granted sometimes.
Yeah.
We've all been in our 20s, we've all played, I have my share of stuff. I'm now super, super healthy. Let's talk about how do we keep our heart healthy?
It starts with healthy thinking and basically eliminating all the junk from your diet. And your body is your temple. Whatever you put in your mouth is how your body's going to respond. And I've always said this, it's what you have in your arteries today is what you've done to your body within the last 5 to 10 years. So plaque buildup, the cholesterol is a cumulative process. It doesn't just happen overnight. So not only do you have to be conscious about what you're eating as far as eliminating the bad sugars and the cookies.
What are bad sugars?
Anything that is made up of white powder, the cookies and the donuts, etc. The bon cheeks for our Armenian colleagues. So, but also you have to pair that up with exercise. I see people that go on crash diets, they lose about 30 pounds, and then essentially they get disheartened, and then they go back to their old ways. If you change your lifestyle and you eat healthy, but you also exercise 3 to 4 times a week, make that part of your life. And I don't want to hear when people say, I don't have time, I'm too busy. I get up
What the heck is that?
Yeah, exactly.
Well, that's an excuse. And here's the deal. When you're sitting on the couch watching TV and you have that 4th slice of pizza, you just don't wake up overweight. And the part of all of this that is astounding to me, in the United States, we're the most obese country in the world.
Yeah.
But yet on this side, we talk about health and exercise. Dr. Rafie, when tagging on to what Dr. Balian said about healthy thinking, what is healthy thinking to you?
So, all the right choices. So, healthy diet, starting with the healthy diet. So, just make sure that we have a rainbow diet, including as much as natural foods that we could include in our daily diet. So, make sure we have enough vegetable, fruits, and cut down on the amount of the red meat we are taking, on a daily basis. And if you want to take that, just make sure we choose the leanest part of the meat. Make sure, based on the American Heart Association guidelines, we use fish at least 2 times a week, and cut down on the use of trans fat and saturated fats.
When you say trans fat, doctors, what do you mean? Let's be very specific so people know what trans fat is.
So would be like the fats that are main source of that would be from animals.
Okay.
So, and the other thing that Dr. Balian also mentioned is just including exercise. The new guidelines, they recommended at least 150 minutes a week of moderate to vigorous physical activity, or 75 minutes of vigorous physical activity. And it's not that hard to include it in our daily basis, on a daily.
But then what do you say to somebody that says, oh, I don't have time?
So again, the guidelines say that, okay, 30 minutes of moderate to vigorous physical activity. How you don't have time? How about 3 10 minutes? How about 6 5 minutes? I rarely use elevators in the hospital, and I usually don't walk on the stairs. I try to run. So people who know me, they sometimes laugh. But
They can laugh all the way. They can laugh all the way to your healthy heart. I don't. There's somebody that I know, and she made a comment because you remember this. I was 30 pounds heavier, and I made a choice to eat healthy and get a lot more physically active. And she said, "Why? How did you lose weight?" And I said, "I got tired of the excuses of eating poorly and sitting on the couch and watching TV and not being active. So I started running, doing yoga, doing boot camp, getting on a spin bike." And she said, "Well, I just don't have time for that." I said, "Well, tell me about your lunch." And she said, "Well, I have lunch with the girls. What do I do?" And I said, "Cut your lunch in half, put on sneakers, walk around your workplace." And she goes, "What are people going to say?" And I said, "Well, they're already talking about the weight you gained." So make a difference. And I'm not trying to be rude, but it's true.
Right.
We spend so much time being unhealthy with our excuses instead of being healthy with our choices. Grab a girlfriend, go, "Hey doc, let's go for a walk around the campus." Something I saw earlier today said that a lot of heart disease comes from people sitting at their desk for hours and not getting up, not doing anything.
Right.
True?
Absolutely. And I also about thinking healthy, just the mere fact that some of these people that had quit on going to the gym, just the fact that they get themselves inside the gym already changes their mindset. And I tell some of my friends, just get yourself here. And the fact that you are here already tells you a lot, that you got out of bed and you made that commitment.
You made the choice.
You made the choice to be in a healthy environment, and then eventually you start committing to that. So I think it starts with thinking healthy and modifying your lifestyle. And the weight and the pounds will come off, and eventually the plaque in your arteries will regress.
So something that happened 5 years ago, and because you were saying something about the plaque from 5 years ago, you make a lifestyle shift and you make a choice to become healthier with diet and exercise. Does that plaque from 5 years ago ultimately go away?
Well, there are many studies that show a plaque regression with exercise and modification of your diet. So not only do you not have plaque progression, you also have plaque regression and also stability of plaques that could have potentially ruptured and caused a myriad of things, such as a heart attack, stroke, inability to get adequate blood flow to your legs, etc. So plaque buildup is a process of inflammation that comes from lack of exercise, stress, all the ill things that we do to ourselves, such as smoking, etc., and also bad diet. So, and I do want to mention genes have a lot to do with it too. Some people
hereditary.
Exactly. Some people have had multiple family members with early aged heart attacks and strokes, and those people have to be especially careful because they are at risk for having premature onset coronary disease and vascular disease.
And this is one thing too that I want to say is this is when you talk to your parents, you talk to your grandparents, you talk to your aunt, your uncle, your family, and say, what is our family history in regards to heart health, to health period, because you're born into this family with the generations of the past health. More with Dr. Rafie and Dr. Balian when we come back. Don't go away. Welcome back to Healthline. I'm Gregory Zarian, and as I've said repeatedly, it's all about affairs of the heart. Joining us from Adventist Health Glendale are Dr. Amir Hossein and Dr. Harry Balian. Doctor, so we've talked about basically being unhealthy can lead to not being here anymore. We've talked about leading healthy choices. But then a lot of people talk about signs and symptoms, and am I having a heart attack? Am I not having a heart attack? Dr. Rafie, what are the signs and symptoms of a heart attack? You take a man, and then Dr. Balian will have you talk about a woman.
So men usually have more typical symptoms of the heart attack, which is like a chest pain, chest pressure, usually exertional with activity, and it improves with rest, sweating, shortness of breath, and sometimes associated with dizziness, like passing out, but the main symptoms would be like a chest pressure. Sometimes they have nausea, they complain of some vague abdominal pain, radiating pain to the back. But ladies could actually have more atypical symptoms, so they just could have very vague chest pain, upper back pain that they come, and usually they also have some risk factors. So it's very rare that somebody would come and just out of the blue, they have a heart attack. They usually either based on their age, gender, and their lifestyle, all the risk factors. You know, Dr. Balian mentioned that he had a patient as young as 22 years with a heart attack. So we always look, you know, with the complementary studies that we could get to have a definite diagnosis. But the main sign that they should always look for would be like a heavy chest pain, pressure like chest
And this is
pain.
the same for men and women.
Well, women have atypical presentation with, as Dr. Rafie mentioned. Whereas in men you get the classic Levine sign where the clenching of the chest, left lower sternum border radiating to the jaw and the arm. Basically, you know, the 4 Ps is a palpable, pleuritic, positional, pointy that kind of rules out a lot of times whether this is a classic angina or chest pain. If it's palpable where you can actually push and elicit the pain, is it positional? When you lay on your left side you get more pain. Those lead more towards a musculoskeletal or inflammatory component rather than actual heart attack type pain. And then is it pointy? Is at one point? Is it pleuritic? When you take a deep breath it gets worse. Those are some of the questions we can ask to point us away that this is a classic heart attack, although never say never. But in women, to answer your question, they can come in with just vague symptoms, nausea, heartburn, feeling fatigued, feeling dizzy, again, somewhat atypical. And that's one of the classic reasons why we have tended to underdiagnose women when they come in with chest pain and actual heart attack symptoms. And that actually has led to a poor outcome in women that come in with early onset chest pain that eventually leads to a heart attack. We have been more cognizant, and we've put a bigger effort now these days with the ER staff and our medical staff to be very alert and hyper alert about atypical presentation in women with chest pain. So we take everything very seriously. Anything from basically the jaw all the way to the abdomen, any kind of symptoms immediately prompts the ER physicians to get an EKG, and that basically sets the clock to diagnosing you know, possibility of a heart attack. And of course, if it's a STEMI, ST elevation MI, where the artery is completely closed, we have a door-to-balloon time to beat, because every minute is, you know, we say time is muscle. You know, every time you wait an extra minute.
Time loss is muscle loss.
Exactly. So the longer you wait, the poorer outcome you will have, because you have irreversible heart muscle damage, which can lead to the patient becoming a cardiac cripple or even dead.
Well, a lot of people, what they do now too is they self-diagnose. They Google and say, let me see this. Bottom line is, if you think you're having a heart attack,
Take an aspirin and call 911.
Take an aspirin. Baby aspirin.
Right.
Should everyone take a baby aspirin every day?
In general?
In general.
Right. I would say no, because baby aspirin just in lieu of candy is really not, you know, not something smart, because it can also, aspirin itself can theoretically lead to you know, GI upset, ulcers, irritation, and maybe even blood loss. But if somebody has risk factors, family history, and they're 50 and older, I would say yes. If they've obviously had a prior coronary disease, prior stroke, vascular disease, absolutely yes. And if we put a stent in a patient, you know, they get aspirin and a second antiplatelet for at least a year, and then they get an aspirin lifelong. Those patients, definitely. But if you're a 35-year-old healthy woman with no risk factors, I wouldn't say just start taking a baby aspirin just for fun.
What about a man?
Same thing. If you don't have risk factors, I wouldn't just say take an aspirin just for the heck of it.
But if you think you are having a heart attack, take an aspirin.
Oh, absolutely.
Okay. Share with us some great stuff that's happening at Adventist Health Glendale, Dr. Rafie.
Since last year when we were here, we had a great success in our TAVR program, transcatheter aortic valve replacement. We've done close to 45 so far.
Up to 50, actually.
Yeah.
Oh, that's exciting.
Yeah.
So
Congratulations.
And when I was looking at some of the data comparing to 50% of all hospitals in the United States, we surpassed on all categories. You know, I can proudly announce that we, like for example, on the 30-day quality of life, on the average, all U.S. hospital was 55%. We are close to 91%.
Okay, that's
And
fantastic. Congratulations.
So we had the lowest, one of the lowest mortalities, and we had the lowest morbidity. We had the best improvement in the quality of life right up front in the 30 days, and that's compared to national data.
Why do you think that is then?
We have a very strong TAVR team, myself, Dr. Rafie, and we take pride in our work, and we take good care of our patients. And I think it starts from the get-go, where you're very meticulous and you know, you take your time to make sure that you have the best patient care and best outcome. Also, we're in a very nurturing environment. Adventist Health Glendale has provided us with all the opportunities and tools to deliver the best health care and also ensure that we have good outcomes and good success with our patients.
Well, it goes back to also part of one of the mission statements was whole person care and God's love, eating healthy, family. Final thoughts, doctors, in regards to heart health. Doctor? As
we mentioned earlier, heart health starts from healthy thinking and changing your mindset. You know, and make this year the year where you're going to make a change in your life, in your health. So again, put down the donut, put down the bonchik, and sign up to the gym. And again, start eating healthy and start exercising, and you'll see how much better you feel about yourself. And I strongly believe in healthy mind, healthy body go together.
Dr. Rafie?
As Dr. Balian mentioned, we have so many data in that regard, and even like this, the smallest things that you don't think about it. You know, I was involved as part of the research that we studied that even low lifetime recreational activity could prevent. It's actually associated with peripheral arterial disease, which is the manifestation of atherosclerotic disease in our body. And again, healthy heart, healthy body comes from the healthy mind and choosing the right choices.
Thank you so much, doctors. Okay, so we here at Healthline invite you to just start 2018 with healthy thinking. That's it. Mom and dad, get up and get out and take your family outside. Turn off the TV, close your iPad, close your computer, and just become one with your family. It all starts with an intention and a choice. Make 2018 a healthier choice for you. We at Healthline are so grateful that you were with us. Please find us on social media, Facebook at @AHGlendale, Twitter at @AHGlendale, and also on Instagram at Adventist Health Glendale. I'm Gregory Zarian. Here's to an amazing and healthy year for all of us. Remember, the most important conversation you're going to have is about your health, so why not have one right now? We'll see you next time.